listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We're a podcast, and we are also a talk radio show. My co-host, Jeannie Roller, is off today because we have Helene M. Epstein. She is a healthcare journalist and also a national advocate for patients. Helene, we met a couple of months ago, and I've been wanting to get you on the show. You've been wanting to get on. You are just unbelievable with the stuff that you are doing for advocating for patients. And Jeannie Roller and I, Jeannie's the one that introduced us. So happy to talk with you. And then in some ways not, because we really don't want to know this stuff is happening. So we want to get, I know, we have to laugh because otherwise we'll cry. But we want to get the story out today of the enormity of actual patient harm. And it is unbelievable. And how many people Jeannie and Roland and I have met through the couple of years that we've been doing this, sadly. We all got involved because it happened to us or happened to somebody in our family. So, Helene, we don't have much time. 10 minutes goes by real fast, and I want to hear what you have to say because I am just enamored of what you are doing. So go ahead, Helene. Let us know who you are and what you want to talk about.
Absolutely. Well, first of all, thank you for talking to me today. My life is dedicated to reducing patient harm and improving patient safety. And yet I do not have an MD after my name. So I want the audience listening to know there are things that they can do as well.
Mm-hmm.
So as a journalist, I've written a lot about this topic. I do have a column that just ended recently called DXIQ that was read by over 500,000 patients a year. And when we lost the grant, I started a new column that's free, available for free to everybody, and it's called Patient No More, and it's available at Substack, and maybe we can put the link on the podcast link as well. But I'm a national advocate for patients, working with researchers, healthcare systems, government, and patient advocacy organizations. And I speak about what happened to my son, to my dad, to my mom, and to me.
Wow.
And the largest cause of patient harm are breakdowns in diagnostic quality and safety. But there's a lot that we can do, and it does start with patients like us who are eager to advocate for ourselves and our family members. So let's talk about the size of the harm.
Okay.
So patient harm is defined as when there is error in medical care. It could be a wrong diagnosis, or a wrong medication, or a surgical error, and we hear a lot about those, mistreatment in the emergency room, dismissal of pain, or mistreating a patient because someone thinks, oh, they're drug-seeking, or they don't believe women, especially around pain, or young people, or people of color at any age. I mean, medical racism is real. Diagnostic error is the number one cause of patient harm, but not solely, obviously not the sole reason. And diagnostic error happens when a patient is assigned either the wrong diagnosis or the diagnosis is delayed beyond the normal standard of care. It should be diagnosed quickly like cancer, but instead it takes months. Or, and this is really interesting, the diagnosis is made, but it's not communicated to the patient or their family members. And there's a couple of big media stories about that. And it's hard to accurately measure patient harm because too often the healthcare systems, even unaware that they've harmed the patient, or the patient is unaware that how they're feeling and how poorly they're doing is due to an error.
Right.
And the biggest thing is because hospital systems don't report patient harm when they do find it. There was a Patient Safety Act passed in 2005 that was supposed to fix this, but there's a big loophole, and harm is not properly measured. And I'm part of a group called Patients for Patient Safety that is working on closing that loophole in Washington, D.C. But the numbers that we do have, although they're conservatively undermeasured, they're still very, very large. So let's start with hospitals, rehabs, and nursing homes. According to the Office of the Inspector General, 1 in 4 patients in America who are admitted to a hospital, rehab, or nursing home are harmed every year. And that's just the measure of harm that's included in the patient's medical records. We know that that is a small number. Half of them are harmed tremendously, greatly, and it affects either they're killed or it affects the rest of their lives.
Yeah.
But most patients don't get admitted. Most of us, we go to our doctor or our specialist or our urgent care center, and that's called ambulatory care. So if we're just looking at diagnostic error, which is the way that researchers call misdiagnosis, The conservative number of American adults misdiagnosed every year is 12 million, or 5%. And most researchers think the number's more than double that.
Yeah.
And when we talk about children, a rough estimate is 4 million children are misdiagnosed every year. And when a child is misdiagnosed, the harm is much greater. I'm sure you read this. There was a big splashy story last year that 800,000 patients are significantly harmed or die due to misdiagnosis every year.
Yeah.
And that's about half and half. 371,000 people die and 424,000 sustain permanent disabilities like brain damage or blindness or loss of limbs or organs. And there's just 5 diseases that account for 40% of this.
Wow.
Stroke.
Wow.
Sepsis, and I lost my sister last month to sepsis.
Oh, my gosh.
Pneumonia, lung cancer, and venous thromboembolism, which is basically getting a blood clot.
Right, yeah.
And if you can diagnose these conditions quickly and promptly, you can reduce the number of people injured by diagnostic error. And that doesn't even count pain and suffering from highly misdiagnosed diseases like, the ones that don't kill you, like endometriosis. It can take an average of 10 years for a woman with endometriosis to get diagnosed.
Yeah, at least.
Lyme disease, celiac, rheumatoid arthritis, lupus, MS, even hypothyroidism. They're easily missed, and they mess up people's lives when they do. I do want to say, though, statistically, the problem's not due to bad doctors. It's medical training overall, yes, but it's mainly system issues and cognitive issues. System issues would be like the lack of time doctors have to cover your medical history.
Right, yeah.
Or you've come up against this, restrictions on testing because the system has decided it's too expensive to do that test and you don't meet the criteria.
Right.
And
or your insurance.
Racism, your insurance, yes, absolutely. The insurance company is a gigantic cause of a lot of these problems. Medical racism is so common that a whole issue of the British Medical Journal was devoted to it in 2020. So that's an approximate measure of the size of the problem. It does affect every single American in their lifetime, either because you've been misdiagnosed or harmed by medical care, or someone you love has been.
Yes.
And in my family, it has affected everybody.
Yeah, that's so sad. That is so sad. We have like 2 minutes left. I am just appalled at the numbers. I know Jeannie and I talk about that, Helene, so many times that I'm surprised it's that many that are reported for the stuff that we've actually personally gone through, her and I and our families and stuff, and other people that listen to this podcast. It's just crazy. Geez, Louise, we have to stay on top of this. I mean, that's what we're trying to do, and kudos to you that you're doing that. What can we do? What can the average person do?
Well, we're not expecting anybody to start like a new foundation or nonprofit to solve these problems, but there are a lot of organizations out there that are on top of it. So 2 that I'm working with right now that I think are fantastic are Patients for Patient Safety US. That's part of the World Health Organization. And we were just in Washington for 3 days, and we had everybody, CMS, OIG, AHRQ, all of the alphabet soup that represents our healthcare system.
Okay.
And the other group is a research organization that is called Patient Partnered Diagnostic Center of Excellence.
Okay.
And the Diagnostic Center of Excellence has all been started by AHRQ and the government. And they are there to try and improve the problem. And Patient Partnered, or PPDCE, it's a very long list of letters.
Yeah.
They have the majority of their steering committee are patients.
Okay.
And so there's a lot that we can do locally. If people want to reach out to me through my website, I can help lead them towards other solutions.
Okay. We'll put that on the podcast. We've got a couple of seconds left. I want to say thank you so much, Helene, for what you are doing. We are all in this together. No one wants to get harmed. We don't want to see anyone get harmed. Stay listening to Evergreen Media and stay tuned.
Thank you. We so appreciate what you and Jeannie are doing.